as we take care of our brain, we take care of our body. Same way we take care of our sexual reproductive organs. It's not like to a sixth standard kid, we are totally giving a full education about reproduction and all.
So hymen may be present even after sex, and hymen may be torn even before sex.
80 to 90% of men and women feel like they have some sexual disorder
because they are never taught what is normal. Anything being other than a heterosexual and cisgender, is it normal? Hello everyone, I'm Dr. Jill, and today we have with us Dr. Ankit Chandra, who is an amazing public health professional, an author, a researcher, and also a YouTuber and a very successful blogger. So welcome, Dr. Ankit.
Thank you, ma'am. Thank you for inviting me, ma'am.
Today we are going to talk about a book from Dr. Ankit, which is Complete Sex Education Guide. So we are going to talk about sex education based on this book. On the front page of this book itself, we have written sex education is a human right. So Dr. Ankit, what is sex education?
Previously, it was introduced as sex education, where they taught children regarding human anatomy, basic reproduction and all. But now it's the term which is used is reproduction health or a sexual health or a sexuality health education, which is more comprehensive, where they talk about people's orientation, where about quality of life, relationships, and it encompasses all the aspects, physical, emotional, and other domains of the health. This book is free online. So most of the people search on Google using the term as sex. That's why I have put it up as sex education. Basically, this education is about a child turning into a manhood or a girl into womanhood, where like through their phases of life, they will face a lot of challenges. So this education empowers our children to face all those challenges and vulnerabilities in this world. Basically, if we provide this sex education to our children, it can protect them against the harassment. It can mentally make them empowered how to cope with breakups, love, relationship, how to feel comfortable with their own body. Most of the times, this young children, like they will feel, oh, what is this happening with my body? Is it normal or not? If they are not given proper education, their first menses itself can, for female, could be complete trauma. If they are already aware of this, okay, this all changes are normal, they accept it much better. And it also talks about privacy. It also talks about how to deal with certain situations in their life. So sex education is a very comprehensive thing, and definitely WHO declared it as a human fundamental right. But it's still in most of the countries, it has not been provided. Our Indian education system tried to put it up in the normal curriculum, but there was a lot of revolt and all. Then it was taken it out, adult education program as AEP. But now some part is there in the biology, but that is also often missed by school teachers. So the only option for today's children is just to Google, and they may land up into wrong websites and getting wrong information, which is very dangerous.
Thank you, Dr. Ankit. But don't you think that Indian society is very conservative? So do you think this will help the youth? The parents will think that we are spoiling the children by teaching them sex education.
True, there are a lot of myths about sexuality education. But parents only are looking at the one side of it. They do not see it will empower their children to resist any type of harassment. Like child molestation is there, at least they can escape it if they are properly aware. Okay, this is a good touch or this is a bad touch. It's not like to a sixth standard kid we are totally giving a full education about reproduction and all. We are giving bits and bits education, where as soon the child grows, but all information will be required for him, and that is good for us. Previously we used to run marriage counseling session, where you'd be surprised to know few couples we saw, they do not know how to reproduce and all. Now it's very difficult in adulthood to explain and all. No? So that things happens, and it is true. Those stories are also true. Parents definitely will try to protect it. Their overprotection, children will go and learn, because children are very curious and you cannot bound them, especially in this digital era. It's very easy. Just type one word and you will get all the information all over. whichever is present in the word. So whenever they Google or they will ask their friend, and definitely they get it from the wrong source. So if the parents weighs the pros and cons, pros are much higher of sexuality education. Sexuality education won't spoil anything, and sex was already there in our society. Like if you look at Khajuraho, all the temples which were made and all, it was there in even mythology and all. And people even just give us common example of Shivling and Yoni, and all, we worship it. It's not ki it is hampering our ideology and all. It depends on how do we perceive it. If it is seen in a spiritual and a religious manner, it is fine. So same way, sexuality education also can be seen as this part of their normal education. Indian society was very much modern and very much acceptable to that. But what happened is orthodox people or some conservative thoughts have imbibed into our society. Like in the previous society, if you see, when we talk about, just for example, like Africa and all, where women go with the bare chest and all. But as soon as modern things have come up, people have gone into more into isolation, security, more into there is a lot of religious thoughts attached to it. There are certain religious practices which say talking about sex or following sexual practice is completely wrong. It's like you can only have sex when you want to reproduce a children. Otherwise, sex cannot be done for the for enjoyment. Those thoughts our society is imbibed in. There are certain misconceptions about it. Scientifically, sexual health is just a normal thing. Like as we take care of our brain, we take care of our body, we take care of our muscles, like our digestive system. Same way we take care of our sexual reproductive organs.
So actually, sexual education is going to empower the youth. At least it will teach them what is right and what is wrong. If we teach them, then they won't go to maybe wrong sources, maybe porn websites, which may teach them anything. If there is a guide available, which they can follow, which they can learn from, at least it is from verified source, then they are not learning things which may be really wrong.
Even in our medical education, it is missing. So that's why I came with this idea ki why not have a complete sex education book where, like, if you see, like I have given the references, like what all scientific references are there. So like you can cross check that fact. And it's not like this is what I preach or what I teach. This is what it is there in the science. That's why I kept it free. I'm not making any money of it. It's just there free on your Google Books. It is there free on your Kindle. It will come it as a free app, so people can access it. That is the only logic about it.
That's amazing, Dr. Ankit. Even we will also try to give the links in the description where people can access it. I request people to share it with everyone. So giving knowledge is empowering people. Hiding the knowledge is not correct. In one side, we say that in India, we are conservative and, we won't talk about sex. We don't talk about sex at home. The parents do not teach anything to their children. Teacher tries to skip the chapter number 10. No. How can we teach? Isn't it? So no one talks about them. But we are only having the maximum population. So isn't sex education all the more necessary to bring about wanted births and, to stop unwanted births and having unwanted pregnancies?
True. And to add on to it, just one more scientific fact, like there have been a lot of studies done which says like 80 to 90% of men and women feel like they have some sexual disorder. And when they were examined by a gynecologist or a sexual health practitioner, so then they found out that number is less than 20%, but more than 80% feel like they have some sexual disorder. So this gap of what we see around 60%, it's just because of misconception, because they're not empowered with this sexual education. If they are already empowered, they won't go through all that mental trauma, and also they feel ashamed to come out of it. They feel like if I go and tell it to doctor, they're also like a lot of sexual health practitioners. If you see, most of the good doctors who are very good skilled and all, they do not prefer to practice because there's very less patients who are coming to certified doctor. Compared to that, they will prefer to go to a quacks or to a doctor whom they their society or their identity is not revealed.
I think even the doctors who are sex educators are kind of ashamed by people. Ari, this is what you are doing. People don't think this is something prestigious. Why someone is doing like this, isn't it? but it is really so important. As you have mentioned, people think that they have some kind of abnormality because they are never taught what is normal. There is hymen, and when you get married, then people can test your virginity, and when the hymen is ruptured, then the virginity is gone. So there are some tests for the virginity test, two finger test, or the blood spot test, bedsheet test. And is it true?
A virginity of any person, like for males, so you cannot test it. Same goes for female also. Scientific facts are like some part of hymen can regenerate. Second fact is hymen can get torn with anything like sports, even while bicycling, horse riding, anything, any trauma, injury, anything can happen, and it is not a scientific evidence of it. It was a very rudimentary test which was done, I think, ages back and all. Now the Supreme Court and everyone have told this test cannot be done to check the hymen whether it is torn or not. And there are a lot of shapes of different hymen. If we see, some are perforated, some are not perforated. So it's very difficult to confirm virginity of any person. See why people want to do it. When people want to test something, then only some people try to come out like bedsheet test and all. It's a wrong notion which goes in our society. It's like female should be having no experience of sexual intercourse and all. But hymen can part of it can also get on during masturbation and all, which is also normal, healthy. If you look at the Western countries like America and all, there is some surgery have been a very common thing for hymenoplasty, where they regenerate the hymen, and that is done just because if they're in the sex industry, like and they're going to remarry, or it is to increase their own pleasure. So now if there is a hymenoplasty kind of a surgery, then so again you cannot tell whether the person is virgin or not. So with the modern science, and we are going in a different direction these days. It's not about hymen testing and all, it's also about hymen repairing, which has come.
So hymen is not like a strict and tight door. It is not a hard door. It is just like an elastic membrane, just like how an elastic membrane can stretch. It can stretch or it can tear a little. As a matter of fact, even in women who have had sexual activity, there may be presence of hymen. So hymen may be present even after sex, and hymen may be torn even before sex. So there is no question of virginity. So when you can't check a man's virginity, so why are you behind a woman's virginity? So virginity should lie here and not somewhere else. So it is the mutual trust of the partners which matters, and not some membrane which will tell you whom to trust and whom not. According to you, what is masculinity?
Masculinity, if you look at the dictionary, it's kind of like attributes or character of a man and all. But there is no checklist. Men should have beard, a man should like blue, cannot wear pink, men do not cry and all. These are all society have made certain statements which keeps on passing on, like real men drive bike, real men don't sit behind the scooty. These are all are myths. So there's no attributes of men. Scientifically, there are genders like men and female. Female can also have certain characteristics. There are certain behaviors which we adopt. Like during our childhood, we will have certain values, certain behavior. But as soon we keep on going, that will also change. As soon the society is also changing, our attire, our preferences, everything will change. So nothing is permanent and nothing is specific about masculinity. There are different society have different beliefs, attitude, and perceptions regarding masculinity, and that keeps on varies.
How these things develop is how the children see what is happening in their own family. When the children see, okay, my father doesn't cry, my father never comforts my mother when she is crying, and he never says sorry, or he never wears any other colors, or when they see their peer group or something. So all these are toxic things which are in the society. So how you should bring your child up is you teach them to feel feeling any emotion is not wrong, but hiding the emotions and saying that no, you are masculine, so you should not cry, you should not feel bad, so that is what is wrong, and that is going to harm them psychologically. So do not teach your children what is, masculine or feminine. Let them feel what they want to feel and what is natural, instead of limiting them. Okay, you should not be like this, you should not be like that. That will only harm them, and they will not mature totally.
Sexes, like if you look at scientifically, there are only two sex, male and female. But when you talk about gender, though different genders come into role, like here, like lesbian, LGBTQ and all. You would have already heard about it. So I think when parents try to force something in, if a child is biologically born with a male gender, but he perceives something of some feminine trait might be there, but there might be certain condition where he's not LGBTQ. He is normal male, but he has a feminine look like this, like his hand is hanging, or he's swaying while walking, or even while he's a long hair. His preferences are different. But what our society does is, our society try to classify into same male or female. Movies have put it up a lot of things into this. If he is not behaving like male characters or female characters, he's an intersex or he is into transgender and all. And society started giving gender, ascribing as a gender, whether male or female. Rather, what should be done is that person should be able to say, okay, I'm male, I'm female, or I am male, but I feel like female, or I'm female, I feel like male, or there are different various combinations. This gender wala thing comes where the society try to give you a gender, like based on how you behave, what do you do, like smoking or alcohol, like if you see most of this still in the society, it is considered only a men thing. If a male start drinking and all, they say, okay, now welcome to the manlyhood and all. Sometimes what is this masculinity thing is used as a trick to make another person to use tobacco, alcohol, or to a wrong things. Like if you're a real mud, then do this, then do this. They try to instigate a person to go for a wrong thing. And this masculinity has been more of misused to manipulate people to do wrong things compared to a good thing.
What is sexuality, and is it normal to be homosexual or transgender also?
Sexuality is a very vast topic. Like people have spent their lives, understanding. And I have certain experiences with few of my patients. So it's like even sometimes even a person might himself will be confused, and it might take years to come out and think, okay, what a real person he is or what he perceives. Sexuality is very different from your biological sex. Biological sex, as I already told, is only two, male and female. There could be intersex also, like a child who has testes but has also part of uterus, and so those
differentiate
cannot become
them into male or female, then that becomes
female.
intersex. Okay.
Intersex. Those are the ambiguous genitalia. Like, some problem happening inside the womb, then intersex baby might be born. But with the help of today's modern medicine, a sex assignment surgery at the time of birth can be done based on what is this hormone level, what is this XY chromosome, what is the preference, how much is his body has made and all.
Or recently, I've also heard that if a baby is intersex, we can wait till the baby is, at least 5 or 6 or 7, and then the baby will tell you, I am a male or I am a female. Means who
True.
are you to decide that person is a male or female? Why don't you wait for the person to tell you?
That is true. In olden days, so people used to, like, for such babies, people will just donate them to a transgender group. They won't even bother to see what is there. They will just say, okay, he's a hijra. Sexuality encompasses how a person behaves. What is his sexual orientation? What is his sexual preferences? How a person projects himself? How he likes to be called himself? How he wants it to be treated himself? It's not a male can only have a sexual preference only for female. He can also have a sexual preference for a male also. So sexuality is not about male and female combination. So it can be about male to male. It can be female to female. It can be a very different combination.
So, Dr. Ankit, would you like to tell what is LGBTQ?
When we talk about sexuality, he can be a heterosexual or a homosexual. Heterosexual is where male is having sexual attraction toward female and female having toward male. That is heterosexual. When we talk about homosexual, same gender having a sexual attraction toward the another same gender, like male to male, female to female. Now this whole term have elaborated as people have come up with their own sexuality. You'll be surprised to know there's something called even asexuality, where people do not have any sexual attraction toward any opposite gender. When we talk about LGBTQ, L stand for in this is lesbian, where a female is having a sexual attraction toward another female. G stand for gay. Gay is actually means homosexual. It incorporates actually all types of homosexuals, but generally as a slang, it is used for male to male homosexuals. T, which is transgender, which is a very broad umbrella, which includes trans women, trans men, the people who have undergone gender reassignment.
Reassignments.
Like you were telling, in the adulthood, the male becomes a female and all. So those are also included into trans. And then is a queer. In queer, it's also, again, it's a full big umbrella where it includes homosexuals. It includes also heterosexuals who do not want them to be assigned any gender. It also includes bisexuals also. So that is LGBT.
So queer is a whole umbrella term. So anyone who belongs to LGBT community can also say that I am queer. Maybe LGBT or anyone, even IA. So the spectrum is ever increasing as more and more people are finding about their own sexuality. So these terms are new terms are being coined. Dr. Ankit, is being a homosexual or anything being other than a heterosexual and cisgender, is it normal? Is it natural?
If you consider the opinion of doctors, like there are a lot of association, American Pediatric Association, American Psychological, American Psychiatrist, and there are a lot of even Indian Association, Indian Doctors Association. Everyone consider it as a normal thing. Scientifically, it's completely normal to perceive or to feel or to express yourself in whatever manner a person wants to, because at the end we all are human beings. We can all have different preferences. Like for food, you have a different preference. Same way, a person can have a different sexual preferences. It's completely normal and completely scientifically okay to be homosexual or anything in LGBTQ or any other way if a person wants to express himself.
It is everyone's own preference, and there is nothing wrong in being at any part of this spectrum. All of this is completely natural. So we should be inclusive.
LGBTQ were there even in mythologies. Even if you look at the Greek mythology, Indian mythology, those people, those things were always there and it was completely always normal. But only the thing was, these people were always harassed. And even now, even if you see a lot of good movies, even one of the movie even won Oscar and all. So like they used to, even in allopathy, they used to give them electrical shock and all, thinking it is kind of a disease. And especially parents are not able to digest it. Oh, how come a homosexual, or how come our child being a male is thinking like that, or being a female is thinking like in opposite direction. They get panicked and they do not accept it as natural thing, because they always try to they have a mentality of comparing their children with others. They are being in a competitive mode. So parents are the one who also torture them in another way. And these people are most of the time harassed, mentally tortured, and they have a very bad history since childhood and a lot of trauma and all. So what do's and don'ts I have prescribed in my book is, at least as a good human being, we can show little bit of empathy, compassion toward another human being and make them feel comfortable. At least we should not be part of any form of harassment toward them. Seeking any help for these people or for LGBTQ people, it's very difficult. So that's why they are always in the closet and they may not even come out very easily. What are their preferences and all? They always try to have a secret hidden group and all. So the Indian government in 2018 only, they decriminalized Section 377, where this
It's okay. sex between the same gender also. It's okay for men to have sex with men and women to have sex with women. This has been decriminalized. So this was made criminal during the British rule. If you take our Indian history and see, transgenders were very much part of even some of the military ranks, and they held positions in the courts of the king. Even if you take up Mahabharata, you see Ramayana. So everywhere, many instances are there where you can find homosexuality, you can find transgender people. So this is nothing new, this is nothing alien. So why you have to treat them like alien? Huh? So treat any LGBTQ person like how you want to be treated, isn't it? So everyone wants to be treated humanly and nicely. So you need not differentiate and you need not be biased. So keep your opinions to yourself, just treat them as human. So that's all the LGBTQ people also will want.
Definitely. If we make our school as very friendly toward LGBTQ, I guess most of the problems and most of the things will become normal, because the place of harassment is most of the time is school, the toilets, and the senior fellow bully, and a lot of things. So if our education system becomes little much, sensitive towards such these things, I guess a society, because school is a place where all the future brain and all the people are nourished, and they imbibe all the values, belief of their culture and all. If the school itself can become a nice place where we say, okay, LGBT being or feeling homosexual or feeling expressing yourself in different form of sexuality is normal. Different form of sexuality is being accepted and made to feel normal. I guess such society, such culture will, will definitely bring a lot of change in the current scenario.
And at the time of puberty, in the teenage only, all these doubts and all these clarity regarding one's sexuality, one's own gender, one's sexual preferences, someone likes male or someone likes female, or they do not like anyone. So all these keeps becoming clearer and clearer. But due to our social norms, no, male has to like female, female has to like male. So everyone else is just confused, and other people harass them on basis of this, without knowing that everything is normal. It is a person's choice to like whoever they want and express themselves like whatever they want to be. If someone who looks like a male but does not feel like a male inside, they want to be expressed as a female, it's their own right, isn't it? So who are we to judge them?
True, it takes a lot of daring, it takes a lot of confidence, it takes a lot of trauma, I guess. Like, I don't know trauma, but a lot of challenges to, to one person to classify himself as one sexuality. Because like, if you see, like, there was one case, one of the person came to us, and like, he was like, initially, like, he used to wear female clothes and all, and he used to feel nice and comfortable. So he used to he thought like maybe he's trans. This is what he thought. He went and started staying with trans and all. But in between, like, then he thought he prefer having sexual attraction more toward male, and he used to like female clothes and all. So in between, sometimes he got a thought, okay, maybe wearing a female cloth is kind of a fetish rather than any sexual preference. Then he thought maybe he's gay. So he left the transgender. Then he thought he performed, like, he had a sexual encounter with a female. Then he classified himself as bisexual. So if we see his journey, it became like trans to gay to bisexual. And God knows, like, if in future he wants to change, or he wants to undergo any surgery, or he wants to classify himself as particular one person, again, it may change at various stages of life, as well, how he perceive, how the society is also accepting him. That also makes a different change, and how much he's empowered. That's why I'm saying sex education is a very important component.
Yeah, and also if you see assault and suicides, all these are very, very common in LGBT community as compared to maybe heterosexuals and cisgender people. So all this is happening because the cisgender and heterosexual people are not, not treating them as the same. So we think that one thing is normal and one is abnormal. No, see, God has created everyone. So all this is also natural. Unless we stop believing in this is normal, this is abnormal, unless we take it out from our own mind, how can we empower this community? And they will keep facing the harassment and abuses. So many of them just commit suicide to that, even that is better than having a life which is so difficult. Yes, so the sex education book is going to be a big help in regards to the LGBT also. So for a person to identify their own sexuality, their own gender, their own orientation. So for that also, we definitely need the sex education in schools. So I will appeal everyone to share this book the maximum you can. We will be providing the links in the description. So thank you so much, Dr. Ankit. And this is not our final talk. We will have many more talks in the months to come.
Yes, sure, definitely.
Thank you so much, Dr. Ankit.